Welcome, everyone, to A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. And tonight, my show will focus on a way forward. A way forward, the way forward for our country, for the world, back to some kind of semblance of normalcy, back to studying, back to working, back to life. And how do we get there? Every leader of every municipality, every state, every world government is looking for a way forward. And there have been many developments around the world in order to find that new normal. For example, in Britain, they've trained dogs to sniff out COVID, hoping that they can send them out and have them find people who are sick and shedding virus. States across the country are fighting back against executive orders telling them to extend stay-at-home orders, keeping businesses shuttered. There's a troubling new reality out there where law enforcement is now having to deal with crimes in the age of a pandemic, where robbers and other forms of criminals, like drug dealers, can simply dress up as pizza delivery people or folks wearing masks for COVID response. And here in the United States, we recently had our president holding a conference to inform the world that there may be a vaccine ready as soon as early next year, or even maybe at the end of this one. It sounds very promising, but we don't know what's going to happen. So we're going to dig deeper into a way forward for all of us tonight here on A Mexican Crossing Lines. Thanks for being with us. I know that you have many other places you could be, but you've chosen to spend your evening with us, so we really appreciate that. We also invite you to follow us on social media, on YouTube, if you're watching there, and share our content. Make sure that you support local independent media like KPPPLP, and leave us your comments and questions.
For sure. In fact, you can do it a couple of ways. One, you can call our message line at 701-566-0917. Again, that number is 701-566-0917. Leave a message up to 3 minutes. We'd love to hear your lovely voice. If you'd like to write to us in an old-fashioned email, Cindy at kpppfm.com, or me, Duke at kpppfm.com. And you can go over to Facebook at 88.1 FM Fargo Moorhead, Mexi-Can, and the People's Press Project. YouTube, we're at Duke 1517. If you're watching on there, we're all simulcasting on YouTube and Facebook Live. You can go to our website at kpppfm.com. Have a look around, look at our programming, look at some of the things we've been doing over the years, and also make a tax-deductible donation to our nonprofit organization, because we are nonprofit media. Go to kpppfm.com/donate. We appreciate that you're here, and we want you to have a good show. If you're watching it on the replay, thank you. If you're listening on the radio and you're driving around Fargo Moorhead, it's a beautiful evening out there. Keep on listening. This will be a great show.
Yes, thank you very much. Let's get to our world numbers. Right now, we have total confirmed cases of 4,892,550 cases, inching ever closer to the 5 million mark of people that have contracted this deadly virus all around the globe. The deaths globally are at 322,821 cases. Of course, the United States is still leading in numbers of cases and numbers of deaths. Currently, we have 1,570,470 cases. we have 93,521 deaths and 361,160 reported recoveries. New York currently is standing at 362,608 cases with 156 new deaths. New Jersey stands at 151,014 cases with 143 new deaths. Illinois is at 98,000 people that have contracted the virus with 145 new deaths. Now, the numbers continue to rise, but our country is beginning to reopen. When other countries around the globe began their reopening, their flattened out curve looked a lot better than ours. Ours looked like we're going down some steps, but we haven't gotten to the bottom of them. And we definitely haven't actually flattened that curve. How are we doing in Minnesota?
Well, not so good. We have 17,029 total positives. And in the past day, there were 665 new reported cases and 17 newly reported deaths. That's just in the past day. Out of this, deaths are at 748, and they are 608 are from nursing homes, assisted living facilities, which is really bad. Now in our county, if you look at the cases around the state, our county is the one to the left, upper left, sort of, at 318. It's Clay County, 318 cases in Clay County, and the county below us has 11, on the edge 51. One, to the east of us is 32, above us is 11. They're small numbers. The reason ours are high, with 318, with 20 deaths, is because of we're next to Cass County, which Cass County, of course, is in North Dakota, and it's really increasing there. There's been one new death in North Dakota, a man in his 90s from Cass County with underlying health conditions, and 56 more people tested positive in Cass County yesterday. Our numbers have been that high. They've been in the 20, 30, 40, 50, 60, 70s in the past days. They keep on going up. The total positive in the whole state of North Dakota is 1,994. That's 63 more people from yesterday. And total deaths is 45. There's one more from yesterday. Now, here's an interesting little tidbit I think was important. Deb White has been studying the numbers, and she tends to send her stuff to the Fargo Forum as letters to editors, but she wrote this post today. She said, "Hey, friends, as you know, I've been tracking the daily reports of COVID-19 cases in our region. Cass County just had their largest one-week increase in COVID-19 cases. In the last 7 days, there were 363 new cases compared to 223 in the previous week. 6 of 7 days were in the top 10 for the highest number of new cases, including 2 new recorded highs. As more places begin to open, we make plans about the upcoming holiday weekend. Remember that we have a role to play in making responsible choices to protect ourselves and our community."
That's right. We have a role to play. And in some states, like, for example, Iowa, the new numbers have not been updated. My father was so concerned about the fact that the information wasn't available, especially for Muscatine County, which had quite a large number of people contracting the virus due to nearby meatpacking plants. Turns out they didn't update the numbers over the weekend, which is very surprising because he says in Iowa, the numbers have been growing daily, the number of cases and the number of deaths. He said, got to the point where they were reporting an increase in cases every day, and there was at least a new death.
Yeah.
But over the weekend, nothing. And he believes, and he's concerned, that the news wasn't updated to kind of keep people in the dark so they could roll out the reopening of the state along with the reopenings going on in many other states. I guess without too much criticism about the fact that we're reopening while we're on an increase instead of a decrease. Because that is what some of the criteria was for reopening. You were supposed to be flatlining for at least 14 days. So there is a lot of concern, and people are still on their guard. And remember, what's going to make folks feel comfortable about this reopening, as much as we try to do smoke and mirrors and hide information about what's going on in individual states and individual businesses, it's going to come out. We're going to find out what's going on. And what folks really need is transparency, honesty, and safety. They need to feel safe as they go out into the world. Unfortunately, things can continue to get a little bit hairy with regard to the wild interacting with our cities. Even though we've reopened, we still keep having these sightings of animals. Locally, we've had sightings of a mountain lion in Fargo. The Fargo Police Department is now warning the public that there's been a mountain lion spotted in the city. Just roaming around. It's kind of scary. And, it's not the only animals that are wreaking havoc, especially for those who are having their food delivered. A local woman posted about her troubles with the squirrels, eating
her tortillas.
eating her flour tortillas. She said that if you order from Instacart, you can choose the fast and flexible option, and they will go to the store, in this case Hornbacher's, and your food will be delivered to you before you even get out of bed. But then, of course, it will be sitting outside on your front stoop for a while, and perhaps a nasty little squirrel will come and eat your tortillas.
Yeah, at least it's not a mountain lion eating your hamburger.
That's true, but can you put your food in a safer place? This is one of the reasons that I've argued that folks should have their food delivered into their trunk of their vehicle. You can have it, and then when, you leave it open, they come and do the delivery and lock it and go away. Nobody can get your stuff.
Exactly.
I don't know. I think it's a good idea. Let's see some reports from shopping experiences. How are folks reacting to the rules at the grocery stores? Well, at our local Aldi's, someone reports they just went shopping there, and only 2 people in the whole joint weren't wearing their masks. Yay! Yay for Aldi's staff and Aldi's shoppers. Apparently, there are still lots of people in the Fargo-Moorhead area who care about their community. Thank you to the folks doing their job. Who else is doing a good job? Well, it looks like Ultra Beauty. Ultra Beauty is a salon. They're doing a great job. What does it say, Duke?
Well, it says, shout out to Ultra Beauty for doing all the safety things right. Staff at the door to open it and count people. All staff wearing masks properly. Lots of signs that testers can't be used. Cashier alcoholed hands before checking me out. Alcohol gel available for me to sanitize my hands after checking out. I felt safe the whole time.
And just so you know, the Ultra Beauty Salon is located at 4420 13th Avenue South. And they have in-store shopping and curbside pickup, so you can shop online for beauty products, salon services, etc. And guess what? They are doing the thing. Remember the thing I told you was going to bring shoppers out? The thing that was going to make people feel comfortable? Trust. This place had clear signs. Everybody knows what they're supposed to do. People are following the rules to make folks feel safe. That's what you need to do. This kind of behavior, however, is not what you should do. This is what we're not going to do. Take a look at this story posted by one of our former neighbors. Local story. She said, yesterday we stopped at the local liquor store by our lake. Dave respectfully put on his mask to go in. As he approached the door, by the way, everyone, Dave is her husband.
Okay.
He As he approached the door, a young man, probably in his 20s, dressed up in a clean cowboy hat, nice Western jeans, polished cowboy boots, like maybe he'd just come from country church. No mask, steps up to Dave and coughed on him. We will leave it at that, like Dave did. Even as I saw the fire coming into his eyes, Dave chose the high road. But what that young dudette didn't know was that he had disrespected a prize bull rider who could have still whipped that kid's bony, cowardly butt 10 times over. Be the peace. Yes, it's smart to be the peace because that rude individual that coughed in Dave's face, if y'all had gotten into a physical altercation there, and I can understand how you might feel like you wanted to. Mm-hmm. When somebody does that, that's assault. And had that person unknowingly even had COVID, it could be a death sentence like it was for that transportation worker in London.
Exactly.
Remember?
Mm-hmm.
Her name was Belly, I believe. And some dude just walked up to her, coughed in her face, killed her because he gave her COVID. That's the kind of thing that people are getting arrested and put in jail for. You can't go around coughing on someone's face because they choose to protect their community, mm-hmm. because they follow the law, they follow the rules. They don't want to infect others. How does this cowboy hat wearing rude dude not realize that the person wearing a mask is possibly COVID positive? That the reason they're wearing the mask is to keep from spreading the virus to other people. I mean, it's just ridiculous. Mm-hmm. And folks, people are still falling ill. Today, another Latino family posted about how their family has been struck with COVID. This is somebody we know. I'm going to keep their names out of this because they haven't made these posts public. And I know a lot of people are struggling with maintaining privacy during these difficult times. She said, I'm asking all my friends and family to pray for my uncle in your prayers. He has COVID-19. He got pneumonia on top of that, and his oxygen levels dropped. Unfortunately, they decided to intubate. It's been almost a week they put him under at the hospital. Please, let's all come together and pray for a quick recovery. Let's pray not only for my uncle and his family, but for everyone that's suffering this pandemic or other health issues. Let us keep our faith in Christ. We leave this in your hand, Lord Jesus.
Oh.
I learned by looking at this person's posts that this man's wife and daughter have now tested positive.
Boy.
And when they talk about how damaging this is, I want you to get a sense of the variety of situations. The wife is doing okay. The daughter's at home, not showing symptoms yet, but's tested positive for the COVID. Meanwhile, there are folks that are catching this, like this other Latino person in Brownsville, and they're very, very difficult symptoms in Brownsville, Texas, as the state of Texas is slowly reopening. One COVID-19 survivor is encouraging the public to use extreme caution when going out. This invisible enemy almost took the life of Brownsville native 57-year-old Ivy J. Arroyo. Quote, I'm walking up and really gaining tremendous consciousness. I realized that I just felt like I was going to have a heart attack, said Arroyo. My heart was beating fast. I couldn't breathe and just really, truly fighting for my life.
Wow.
The family that now lives in Pflugerville, Texas, said that the virus really makes you take account in your life, mm-hmm. and makes you focus on the love of your family and loving your family and having love for the people around you. Just really, not taking things for granted.
Mm-hmm.
He doesn't just encourage you to be real careful when you're out and about, but also cherish the time you have with your family at home. And, the doctors warned him he's probably susceptible to getting the COVID again.
Wow.
Decker and their sons were in the quarantine for the 14-day quarantine after Arroyo was admitted to the hospital. About a week after he got home, Decker showed signs of the virus, but the test came back negative, while the sons haven't shown any symptoms. So you can have people that are asymptomatic almost the entire way through. You can have people that get it, get over it, have mild symptoms. They're back at work. They're fine. For a majority of people, that's the case. They get it. Sometimes they don't even realize they had it, and then they're back at work. But then there are other people who have this prolonged symptoms for weeks and weeks and weeks. In fact, some people have COVID symptoms for months. The Guardian just put out a new article exploring how weird it is that some folks are just symptomatic in all sorts of different ways, and it just doesn't stop. Like Professor, a professor of infectious diseases, that's what he is, Paul Garner, who you see there pictured, who recently published a blog, which I will share with my audience so you guys can go and check out what it is like to be this guy. The Paul Garner blog is available as part of a link to this article in The Guardian, where they share that this individual has got the weirdest set of symptoms. So this professor of infectious diseases, who, by the way, has had other viruses in the past, says that he became ill as part of what he called the Boris Johnson herd immunity group, which is before the lockdown happened.
Yeah.
He got it then, and 12 days before the lockdown, in fact, to be precise, and he thought it would just pass like it was for most people. But instead, it just went on and on and on. He just published a blog last week, as I mentioned, in the British Medical Journal. And there is now growing evidence that the virus causes far greater array of symptoms than was previously understood, and that its effects can be agonizingly prolonged. In Mr. Gardner's case, it was more than 7 weeks. The professor of the Liverpool School of Tropical Medicine says his experience of COVID-19 featured a new disturbing symptom every day. He called it like an advent calendar of symptoms. He had a muggy head, upset stomach, tinnitus, pins and needles, breathlessness, dizziness, arthritis in his hands. Each time Garner thought he was getting better, the illness roared back. It was sort of virus snakes and ladders, chutes and ladders, The deeply frustrating illness, a lot of people began to doubt him. Even other people that were going through this prolonged COVID, their spouses began to think that maybe there was something psychological going on with them. And since his piece was published, Garner has received a flood of calls and emails from tearful patients that are grateful that he put to pen and ink what he went through, because he's a public health person. And the virus is certainly causing lots of immunological changes in the body, lots of strange pathology that we don't yet understand. This is a novel disease and an outrageous one. The textbooks haven't even been written. Now, this guy, by the way, says that this prolonged form of COVID that he's experienced and that many others are now being documented as experiencing, meaning that the virus doesn't last 14 days, it lasts for a month or can last even longer than that, is more similar to the long-term effects of another disease which he had, which is dengue fever, that comes and goes and just keeps on. He described it like driving around with a handbrake on for 6 to 9 months.
Wow.
Dengue fever, by the way, not coronavirus. But that is how long it can take to recover from the dengue fever. And he thinks that COVID-19, the way he's experienced it, is more similar to that. So every single day, it seems like, we learn of a new aspect of this virus. And including, I guess, the fact that we are learning that there is a responsibility that has not really been fully accounted for by the by the Chinese Communist Party as well as the World Health Organization. In fact, yesterday, the White House, the President of the United States, actually sent a letter to Dr. Tedros, the person currently leading the WHO, in which he made a number of points, including the fact that the World Health Organization has consistently ignored credible reports of the spread of the virus in Wuhan in December, that in late December, the World Health Organization knew that it was a major public health concern and did not act accordingly, that Taiwan communicated that this was a transmissible from human to human disease, and the World Health Organization failed to act, and including the fact that the International Health Regulation required countries to report the risk of health emergencies within 24 hours, but China did not inform the World Health Organization of the transmissibility right away, and including the fact that they wouldn't let independent investigators in to check out the virus, despite recent endorsements for doing so by its own emergency committee. And finally, the president leaves this in the hands of the World Health Organization, saying the following: "It is clear the repeated missteps by you and your organization in responding to the pandemic have been extremely costly for the world. The only way forward for the World Health Organization is if it can actually demonstrate independence from China. My administration has already started discussing with you how to reform the organization. But action is needed quickly. We do not have time to waste. That is why it is my duty as the President of the United States to inform you that if the World Health Organization does not commit to major substantive improvements within the next 30 days, you got 30 days, the WHO has 30 days, I will make my temporary freeze of United States funding to the World Health Organization permanent and reconsider our membership in the organization. I cannot allow American taxpayer dollars to continue to finance an organization that, in its present state, is so clearly not serving America's interest." There you go, from the president himself. There is no other way forward but for the World Health Organization to change the way that it does business. I believe that this letter shows that our country is not ready to completely step out of its dealing with the World Health Organization, and I don't think that that's a bad idea. We need a centralized group that is, all of the world's countries coming together to find a solution.
Exactly.
So that's why continuing to fund the World Health Organization is important to our country, and our participation in it is important. But I also see why the president is putting the screws to Tedros and saying, you guys messed up.
Mm-hmm.
And we can't keep pouring money down a rat hole if you're not going to fix it.
Right. And we don't have much time left. We can't keep on messing up.
We can't mess around. In fact, the president dropped a bombshell on Monday's press conference questions after meeting with business leaders that he is taking hydroxychloroquine as a preventative measure, as a prophylactic against COVID-19. This despite FDA warnings. And this is what he said. Take a listen for yourselves. This is Trump dropping the news that he's taking hydroxychloroquine.
A lot of good things have come out about the hydroxy. A lot of good things have come out. And you'd be surprised at how many people are taking it, especially the frontline workers, before you catch it. The frontline workers, many, many are taking it. I happen to be taking it.
Hydroxychloroquine?
I'm taking it, hydroxychloroquine. Right now, yeah. A couple of weeks ago, I started taking it. Because I think it's good. I've heard a lot of good stories. And if it's not good, I'll tell you right, I'm not going to get hurt by it. It's been around for 40 years for malaria, for lupus, for other things. I take it. Frontline workers take it. A lot of doctors take it. A lot of doctors take it. I take it. Now, I hope to not be able to take it soon because, I hope they come up with some answer. But I think people should be allowed to. I got a letter from a doctor the other day from Westchester, New York, around the area. He didn't want anything. He just said, sir, I have hundreds of patients, and I give them hydroxychloroquine. I give them the Z-Pak, which is zithromycin, and I give them zinc. And out of the hundreds of patients, many hundreds, over 300 patients, I haven't lost one. He said, please keep pressing that, sir. I think, for whatever it's worth, I take it. I would have told you that 3-4 days ago, but we never had a chance because you never asked me the question.
Did the White House doctor recommend that you take that? Is that why you're taking it?
Yeah, White House doctor. I didn't recommend. No, I asked him, what do you think? He said, well, if you'd like it. I said, yeah, I'd like it. I'd like to take it. A lot of people are taking it. A lot of frontline workers are taking hydroxychloroquine. I don't take it because, hey, people said, oh, maybe he owns the company. No, I don't own the company. You know what? I want the people of this nation to feel good. I don't want them being sick. And there's a very good chance that this has an impact, especially early on. But you look at frontline workers, you look at doctors and nurses, a lot of them are taking it as a preventative. And they're taking, totally unrelated, but they take the Z-Pak or the zithromycin for possible infection. Now, I haven't taken that other than an original dose because all you need, you don't have to take it simultaneously. But the zinc you do take. So I'm taking the two, the zinc and the hydroxy. And all I can tell you is, so far, I seem to be okay.
Wow.
And people are scared. There's an app out there. And by the way, the Guardian article, that blog that guy wrote, talked about how, now these apps that are tracking where people go, which are used and activated if someone that's using the app tests positive. I don't know if you guys have talked about the app, if you have looked at the app, if there's an app in your state, if you've, looked at what the downloading of the Google app or the iPhone app that's going to be available to track people to do contact tracing with regard to COVID. Have you learned about it? Have you talked about it? I feel like a lot of people have heard about it and have already decided whether or not they want to have anything to do with it and have either rejected it or have started to use it and downloaded it without giving it too much, of an in-depth look. And for that reason, I wanted to share this interview with one of the creators of the North Dakota app called Care19 app. Tim Brookins was interviewed by my colleague over at 630 Point of View at KVLY. Chris Berg interviewed Mr. Tim Brookins, the creator of the Care19 app, as he explained how he developed this app, how it tracks people's information, and what happens to the data that it's collecting. And basically, I'm going to summarize what I took away from it, which is that you don't have to use the app. The app is obviously not mandatory. It's an assistance. Say you go back out into the world. You maybe at some point become COVID positive, and the Department of Health will be contacting you to trace where you've been and who you've been in contact with. Well, most people have a hard time remembering all the places they were and all the people they came into contact with for one day, let alone the last 14. They only really need to know about the last 14 because they're looking at when you test positive, you have a load of virus high enough that it registers in the sensitivity of the tests available. So they're only going to go back 14 days. So anything prior to 14 days of data being collected on the app are automatically erased as it goes on. If you never test positive, your information is never shared. The only way the information is shared is if you test positive, and there's like a random number that is generated that you would activate with the Department of Health if you had downloaded the app to help you remember, because it's going to track you, right? It's going to use your map location services to basically kind of sniff out packets of Wi-Fi and sniff out different things as you go about your day for the next 14 days. And then if you test positive, the Department of Health will contact you and say, do you remember where you've been? If you can remember without using the app, you don't have to do anything else. If you can't, and you've used the app and it would be helpful to them, you can release that number. Now that number releases your data and it allows it to be seen and shared with other people that are, in the community, to notify them that you went to the grocery store, you went to the Menards, or you were at the Costco, and that people that were there on that same day that were in your vicinity may have come into contact with you. Because it uses Bluetooth, it also may have random numbers that it's picking up or sniffing throughout the day on every day that it's collecting data that it never uses, that are never deployed. But if you become positive, then they can go back and look at the data, say on the day that you were at Menards, and figure out how many Bluetooth connections that thing picked up around you, and look at the numbers that were deployed from their phones that were not registered or saved, and then download those and contact those people. It's pretty interesting how they took a lot of care, it seems, to make sure that all the data is completely destroyable at any moment by you, the person using the app. That it's totally something that is voluntary. It's not mandatory. So if this app helps you, you can download it. If you don't want one, if you don't need one, then you don't have to use it. It would be a smart thing to do, especially if you're going back out into the world and you're going to be constantly in contact with other folks, and you're afraid that you might contract the virus from someone that is non-symptomatic and contagious, or you might give it to them. Then keep track of where you're going on a notepad.
Yeah, be responsible.
Just be responsible.
The app would work really well if people bought into it, but the way it's being set up, they're being so cautious to have the end user be in control. It's a hard sell for people that have any sort of doubt or are scared about their privacy, which they, think they
have every right to be, though.
Yeah, well, but we're in the middle of a pandemic. We have something that spreads so easy. And we need to let other people know they've been in contact. And we can't do that with people's lazy memory or not caring or just not wanting to participate. We'll continue to have more and more positive cases.
Well, if you are not willing to take the app on your phone, just be a responsible person and make sure you write down where you're going.
Mm-hmm.
Keep a little diary. It's only for you. You can
It's a
burn
log.
it after the pandemic is over.
It's a mileage chart, just like for taxes.
You know how they do, right?
Mm-hmm. Yeah, exactly.
Simple. And then that way you're not under somebody's control. Nobody's putting anything on your phone. Nobody's collecting your data, and you don't have to worry about it. But I do highly recommend, and I'm sharing this. It's really long. It's like maybe 15 minutes long. I'm not going to take the time. I gave you a little summary of what I think are the big, main points of that interview. Again, Tim Brookins, the creator of this app, how it works. I'm sure that these apps have similar fail-safes to protect people's privacy. Take a listen to it. See if it is something that helps to, demystify the process by which they track information about who's sick and how they notify other people. Maybe it'll change your mind. Maybe it won't. Either way, you'll be a smarter person. So check that out on 630 Point of View, or you go to the video section of POV Now on Facebook and find the Tim Brookins interview. Anyway, what we know is that Trump has announced he's taking hydrochloroquine. And for just a moment, I would like to talk about what that implies. Because, first of all, people don't usually just take medications that are not prescribed to them for a specific condition, right? In this case, hydrochloroquine is for malaria or lupus or other things, none of which the president has, to my knowledge, and for which most doctors would never prescribe this medication unless you are in a hospital. The only thing that this medication was approved for, as we learned through the testimony of the whistleblower, Mr. Bright, is the hydrochloroquine, which he signed off on and approved. He claims under duress from the White House, but he did approve it for limited use in the hospital. To me, there are a variety of possible scenarios. Come with me on my imaginarium of what this could mean. It could mean that he was exposed to a significant risk of COVID virus, and that in consultation with his doctor, which he doesn't need to share with us, they agreed that he would start taking hydrochloroquine. Possible, right?
Yep.
Possibility. We do know that Stephen Miller's wife, Vice President Pence's campaign
Press
manager,
press secretary.
Thank you. Press secretary came down with COVID, and that the valet for the president came down with COVID, and that some Secret Service came down with COVID. And he, the president, may have come in direct contact with COVID, such that he may have decided to begin hydrochloroquine. Another possibility is that this angered him. This testimony, this information coming out about how his administration allegedly pressured Mr. Bright into fast-tracking hydrochloroquine so that it could be used by anybody. That's what he wanted. And Bright kicked back, pushed back, didn't do what he wanted, signed something that put it into use for hospitalized people only, and then blew a whistle. So this could be President Trump's way of doing, get out of my way. I'm going to go do the thing I asked you to do, which you weren't willing to do, which is make this drug widely available to anyone who wants it. And what better way to push that agenda, if it is indeed what his goal is, than to stop the presses and say, hey, everybody, I'm taking it. I don't even have symptoms of COVID. I don't have any COVID. I'm just taking it because I can. And it's great. And I'm taking the Z-Pack. And I'm taking the zinc. Why? Just for funsies. Which shows you how safe it is. I've been taking it for a week and a half, by the way.
Mm-hmm.
So could possibly be that he's promoting this drug because he wants to reach the goal. But it's really anybody's guess. When I talked to my family and friends about it and said, oh my gosh, I think that the president may have been exposed to COVID. I mean, why else would a doctor prescribe a medication that is only authorized for hospital use to our president without him having been exposed to the virus? I got a lot of pushback from folks out there that said, you believed that? That wasn't real. He just made that up. He's not even taking the hydrochloroquine. Why do you think he would be taking the hydrochloroquine? I'm like, because he said he's taking it.
He said it out loud.
And they said, well, and by the way, I even asked people that have spoken with the president and people that are close to the president and people that are friends or supporters of the president, and they still told me he might be bluffing. This might be a chess move. So I don't know what to think.
Well, for that, for the country's leader to just lie about stuff like that to people, for whatever reasons, how can you trust anything that comes out of their mouth if that's the way they're going to act? If we saw foreign leaders doing that, we'd be all over them lying to their people.
Well, foreign leaders do that, honey. They do. And in fact, governors, governments, they lie to people. Maybe it's a white lie, if you will, but they have to in some cases because they don't want people to panic. They want people to do stupid things. And, when I talked to my family about this, I will tell you that, I said, there's no studies that show that hydrochloroquine has been effective against COVID and blah, blah, blah. And the first thing my dad reminded me of was the fact that my stepmother's sisters take this stuff every time they're going to go on a mission to Africa.
Oh, yeah.
They're nuns. They're missionary nuns. So they take the hydrochloroquine, and it's just like a thing they do every time they get ready for a mission. That's how safe this drug is for the most part, for most people.
Except for the ones that makes their heart stop.
Except for the people that have heart problems that shouldn't probably take it. Mm-hmm. I mean, for everything that you take, anything that you take, there could be complications if you take it the wrong way or if it's, one of our viewers, Eloise Ansaldua, I hope I did that right, Ansaldua said, she got sick with the flu back in November and her doctor gave her hydrochloroquine. And within 3 days, she was better. What? And, just like that story, there are a lot of other people that have told me that their experiences with hydrochloroquine have been good. I'm not promoting the drug. I've always kept an open mind about this. I realize the president knows more than we do. I believe he has advanced information about a lot of things that we don't find out about for days, weeks, or even months. And there's a very real possibility that he continues to push and to promote, even by taking this drug himself against FDA warnings, or saying that he is in order to promote its use in a way that he feels will save lives. I don't know. I guess we're going to find out if this is the new wonder drug, the new treatment for COVID-19. What I can tell you is that until there is a vaccine or a treatment, we're going to have to find a way forward. We're going to have to find a way to live, to exist with COVID, and to ensure that we have a low mortality rate among those that do continue to contract this illness, and have to continue to live in the world, work in the world. What we know in the epicenter in the United States of this illness is that many people are now moving out of New York. Yep, remember I told you about that housing market shakeup, folks? People were moving out of the New York area at rapid speed. Take a look at this little map that shows the 50 top metropolitan destinations outside of New York City where people chose to go to. If we were exporting COVID from New York
Jesus.
to all of the other states, this would be the map of what that would look like. And what it looks like is COVID sent over to Tacoma, Washington, San Francisco, LA, Phoenix, Chicago, Dallas, Fort Worth, Atlanta, Houston, Tampa Bay, West Palm Beach, Miami, Fort Lauderdale, Boston.
Yep, and Washington.
And you know what I think, Duke?
What?
I think a lot of people are going to leave metropolitan areas and go to places like
The
this one.
Midwest. Yes.
Yeah. We got big yards, big spaces, big open spaces,
Less people.
less people, more room to social distance and still be social. I mean, I live here with the man of my dreams, so I can't complain. I got to tell you, it's a pretty nice place to live. But I do believe that a lot of people are going to be heading out of big metropolitan areas and going to places that are smaller. And I also think businesses are going to be moving because if they can't do business in California or New York or other blue states, they're going to move to red states where they can. In fact, you might have remembered last week there were several states taking on lawsuits in which they are fighting against the executive orders of their governors extending stay-at-home orders beyond the original month-long stay-at-home quarantine. And in places they are being successful. They have managed to, in Wisconsin, they managed to thwart the orders and reopen their businesses. But in places like Oregon, the fight is still going on. The governor of that state appealing a lower judge's decision to overrule the continuing stay-at-home orders issued by the governor. Brown filed paperwork within hours of the lower judge's decision to have an emergency review done by the Oregon Supreme Court and to get a stay on the order of that lower judge, which was granted immediately. She made a statement. From the beginning of this crisis, I have worked within my authority using science and data as my guide, heeding the advice of medical experts. This strategy has saved lives and protected Oregonians from the worst of COVID-19's pandemic, said Brown. There are no shortcuts for us to return to life as it was before this pandemic. Moving too quickly could return Oregon to the early days of the crisis, when we braced ourselves for hospitals to be overfilled and ventilators to be in short supply. And there is no timetable for the court to make a decision once it hears the appeal. Folks, what this means is people are going to be on their own. Businesses are going to be on their own in deciding, in doing. And I told you that, we do have a lot of responsibility. We cannot expect our mayors, our governors, or our president to make all of those decisions about whether or not we reopen, what kind of treatments we will accept or not, whether or not we wear masks, whether or not we follow contact tracing and use an app. All of those decisions are still in individual hands, your individual hands. And you have to be responsible with those decisions. For myself as a person of high risk, living with a high risk individual. We are both high risk individuals because of our age and comorbidities. I cannot but stress the need for you to consult with the doctor, listen to science, protect others from the virus, from asymptomatic spread, from community contact spread. Stay at home if at all possible. But for other people and for other people's businesses, for other people's realities, that advice is just not something they can follow. In Oregon, as I said, they have ruled that the statewide orders were invalid because the governor didn't get approval for the extension from the state legislature. So what are they doing now? They're in limbo. Because of the appeal. There's been a stay on the lower judge's orders, which means the stay-at-home orders are still in place. And as they hear the appeal and return their decision, the entire thing keeps going.
Yep.
Probably it will surpass when the governor would have lifted those orders naturally. So for those people that are rushing to take cases to the courts to fight against this, just know that it can fall in different places. In some cases, it's going to fall in your favor and you'll be able to reopen. In other cases, it won't. And in Arizona, they're deciding in their state legislature whether to give more limited liability to businesses that reopen during the pandemic. You see, I told you, it all comes down to liability. The president is contending with it. The state governments are contending with it. Local governments are contending with it. The governors usually issue licenses for businesses to operate. If they do not come down and enforce the law, believe me, AGs don't want to do it. Police don't want to do it. Governors don't want to do it. Health departments don't want to do it. Nobody wants to close businesses. Nobody wants to keep people from earning a living, going to school, seeing their loved ones, saying goodbye to the people that just died without you in a hospital. Who wants that? Any of that? None of us do. But if they don't enforce the laws, they lose their legal authority. They lose precedent. They lose everything. And yet, here we are in a pandemic where these extreme conditions call for different measures, extreme measures. But you just can't jump over the law. You can't skip it. So, unfortunately, folks, as much as it hurts everyone to go through all of these different things, these court battles, these fights with law enforcement, these arrests, these protests, these are the growing pains that we have to muddle through as a country in order to get a decision, a new paradigm, a new way of doing things that will take us forward. Instead of being angry at the police officers that are just doing their job and trying to enforce the law, try and be patient and understand that there's a process to everything and that this is just part of that process. Will Arizona's legislature be leading the way in teaching other states what they need to do so that their businesses can reopen, so that jobs can be filled again? I don't know. It all remains to be seen.
And also with legislatures, a lot of the states are ending their sessions because they usually end in the springtime. So their fight in the legislatures may keep the legislatures open longer, or it may not get resolved in this session. And you're listening to KPPP 88.1 Fargo-Moorhead, adding local color to your airwaves.
It's interesting how many people in our comments are going crazy with the hydrochloroquine discussion. Yeah, some people are like, he's not taking it. And some people are like, he's totally taking it. And some people are just weighing in on whether or not it's effective because it does, some people have used it. They've used it and it does help them. In fact, one of our viewers that says that she is, she knows it reduces inflammation, which is a big factor in COVID-19. And when used with zinc, it allows the zinc into the cells and it reduces the viral load.
Okay.
So without the hydroxychloroquine, the zinc can't enter the cell and reduce the viral load, which is why they're taken together.
Okay.
And you take it with the Z-Pack, it's effective prophylactically when used early, like day 4 or 5, like right at the very beginning. And folks, you got to remember, he was just exposed to the virus. For a lot of folks, I know all you want is to go back to work and not have someone cough on you because you're wearing a mask because your job told you to, not have somebody come in and assault you, break your arm, or shoot you in the head because you told them they have to wear a mask in Costco. You just want, yes, Brissy, we all want to just see respectful, responsible human beings. That's what I want. I think that's what everyone wants. Brad is commenting. Brad is part of the service industry. Brad says he's been working again, and it's slowly but surely gaining steam. That sounds fantastic. Mike is commenting. He says it's a choice between patients and their healthcare providers. Exactly. It is a choice. And you have to go to the people. You have to talk with the people that are there to advise you how best to move forward with your health care. I know right now a lot of people are so scared of getting COVID, they're not getting medical care. They're not calling their doctors. I also would recommend, after listening to pieces of that blog or reading pieces of that blog, there are people that are joining support groups, COVID support groups, sharing stories with other folks that have this disease can also help you figure out what might be useful. Colleen comments, ours in Texas have been open, and I understand they've been crowded. I'd enjoy driving down the beach, but not getting out if it's crowded. Cindy, so very many people don't think it's real. COVID, you mean, right? Or that they're special and they won't get it. Makes it hard when no one is wearing masks and thinks nothing about getting into other people's spaces. Exactly, respectful and responsible. Folks, I can't fix those, especially the young, the invincible, the eternal people that think that they are supermen and women. I can't change their perception of self. And normally, we have so many people threaten us that there is a meteor headed toward the planet, that Y2K is coming, that the Martians are going to take over the planet, that a nuclear holocaust is coming, that climate change is going to destroy our towns. Innumerable immediate threats to our lives and our livelihood are told to us every day. And if it wasn't for that resilient part of your brain that goes, nah, you're going to be fine, you're not going to die, we would probably already be in a loony bin. So I think under most circumstances, that survival mechanism that tells you, no, you're not going to die, is a healthy thing. But right now, we definitely need people to be hyper vigilant because this is a virus we've never experienced before, and it is scary. But here are some good things. Guess what? Moderna, the company that is coming up with the virus, they've got some preliminary results back. And guess what they found? It's working. Now, if we can get a wider scale of volunteers being tested, and it works in them, and we get on to major trials, we theoretically could be vaccinating people by the end of the year. Now, it remains to be seen how many people will actually take the vaccine, but we're seeing a light at the end of the tunnel, and that's good. In addition to that, new research shows that T cells in your immune system become keyed to fight this particular organism. And they are finding T cells that are coded to fight COVID-19 in some patients that have come down with this disease, which means we can develop immunity to this virus. And that is good news. We have people that have been treated already with convalescent serum, that part of your blood that has the antibodies to COVID-19, and people are already recovering from almost certain death because of those treatments. We have the ability to form some immunity, as I just told you, T cells are letting us know about. And we might have a vaccine by the end of this year or early next year. So, folks, we can find a way forward. We just need to be responsible, respectable, and logical. And I know all of these new rules about how you get around in the world are confusing as hell. And I am praying for you all out there to figure them out. This poor guy that goes to get some money out of the bank is having a hard time. You know those little footprints they put on the floor to tell you where to stand and where to go? Check out how this guy is using the distancing footprints. Take a look. He's at the door, and he sees the footprints. He walks up to the footprints, and he's like, okay, next.
Jumps over.
Like leapfrog.
Yep.
It's window to window. Where do I go? I've never seen anybody doing this at the grocery store. I swear I would die laughing if I ever saw that. Obviously, that's not the way you use the footprints.
Yep.
Some people are even annoyed about those footprints. You know, they don't want to. They don't want to be treated like sheep.
I'm not going to stand where it says to
Told
stand.
where to walk. I have a sense of humor about it. Actually, because we're high risk, we don't go out and do shopping. We have other people do shopping for us. But folks, you got to laugh. You got to have a sense of humor, and you have to, be a community. Be the unity, be the love, be the support, be the community that you want to see around yourself. We have a lot of people out there that are high risk, that are scared, and that cannot go out. When they do go out, they may be wearing masks. Please do not cough on them. Please do not shame them, shun them, ridicule them, or threaten them because they may have COPD, or they may have asthma, or they may have the virus. Okay? Let people live. Let people live. If they're not bothering you, they're not putting a mask on you, leave them alone. Folks, that's all I have for you today here on the Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You are listening to 88.1 FM KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. Keep sending me all of your comments and kudos for local businesses. Who's doing it right? Who's doing it wrong? Who's leading the way forward? And we will share them here on a Mexican Crossing Line. Thanks very much, folks. Have a great evening. God bless and good night.